I know I've met a few of you in the past there in Kansas. It's good to see you again. I'm Ron, a dentist with the tribe, and I'm a consultant now. I retired a couple of years ago, and we're teaching a course this week here at the training center.
Okay. So I have Dr. Willard in here also with me. I'm just going to run through the Alaska DHAT model presentation, and then I guess we'll do questions at the end. So, good, I'm still good with my sound? Okay. So I was with the first group of students that graduated in 2004. So that means we've been out practicing for almost 10 years now. And we went to New Zealand. The Alaska models set up the structures like that. It's a two-year post-high school program. And I'm just going to look and just kind of read off our scope of practice. So we're able to do diagnosing and treatment planning. We do all kinds of prevention, and that's kind of the basis of our program. We're focused on prevention. We see patients of all ages, although many of us do focus on children, but we can treat people of every age. We take radiographs, and of course, like I said, solve infection control. We do all kinds of restorative treatment. We're able to do urgent care. We can do extractions on primary and permanent teeth. And we get involved in our communities and schools and do projects in the school and out in the communities also. We do clinical management. We're trained to do repairs on our equipment also. And we do referrals for things that are out of our scope of practice. So in our prevention, I just want to mention that we focus highly on sealant programs. We do cleanings, fluoride varnishes, and we work on getting fluoride in our communities that we're in aren't fluoridated, which a lot of Alaska is not fluoridated. And we do oral hygiene instruction and dietary recommendations. Some of the routine treatment that we do are, like I said before, in our scope of practice, all kinds of fillings, that's silver fillings, the white fillings, extractions, I said that too, extractions, simple extractions of permanent teeth, primary teeth extractions. We do all kinds of treatment on primary teeth, including pulpotomies, which is like a baby tooth root canal, and stainless steel crowns, and sedative and temporary fillings. Just routine care on patients. We communicate with our dentist through telemedicine, and so we're able to just stay in contact with them very easily, just depending on where we work and how our programs have been set up. Sometimes we speak to our dentist every day, just regularly. We have a time. Sometimes we just contact them when we need to, just depending on what we're doing. We always have to when we're doing a permanent extraction. So we communicate through, like I said, telecommunication. And then a lot of us, I'm not sure if all of us do, but many of us have digital radiographs. So we can be looking at our x-rays while we're talking to the dentist, and they're looking at the same x-rays. So it's very easy for us to communicate with our dentist. And like I mentioned before, we have school programs set up. We don't all do the same thing, but many of us just have different programs set up in our schools and in our communities where we do programs of toothbrushing and fluoride varnish. And I set up a no cavities club in our school. We made a big deal out of that. And we also have done a parents, grandparents, and parents-to-be support group where we just get together in the community and talk about how we can raise our children to be cavity-free. So that's been very successful too. I know there's folks that have been more involved in like the Head Start program and pre-K, doing things like that also. We get involved with when public health nursing is there doing the well child checks, and we try to get in with those guys sometimes and do our fluoride varnish there with the young kids. Let's see. That I've got just a great presentation with lots of pictures that I like to show, so I'm just kind of running through that to see if there's anything else that I want to talk about. That's, I guess, sort of what we do in a nutshell. So I can take some pictures, I mean, not pictures, take some questions if that jarred anybody to ask questions on any of those things.
Stephanie, can you tell us what was it like doing dental therapy 8 years ago compared to now? What has changed?
Well, I'm not sure. Hold on just a second. Okay, so yeah, once I first moved out to the village where I worked when I came back from school, I was inundated with emergencies constantly. There were so many people that had not had care in a very long time. A dentist was out there once or twice a year for a week, and they always kind of just did emergent care too. So when I first went out, I was just bombarded with people with toothaches that had toothaches for a long time. I mean, I could not believe children would tell me their tooth had been hurting for months, you know, and that just seemed like normal to them. You know, they would just say, oh, it's been hurting since this summer, or, you know, for the past several weeks or whatever, you know, just a constant chronic toothache and maybe swelling too. I mean, they were just lots of urgent care, I would say. I mean, I just felt like that's what I did constantly, and it took a while to get a handle on that before we could set up some prevention programs. But just being out there longer, you know, helped me get control of that and just, you know, able to catch up on. I mean, there was a lot to do, just to take the classrooms and try to just do that. After we got all the emergent care kind of tackled a little bit, then I started just taking a classroom at a time and doing their exams, and then and every child needed maybe 3 or 4 appointments. So, and then some needed a full referral if it was things that I couldn't do. But it took months and months to get that under control, and then we just, I mean, maybe even like a year before we got through everybody at the school. And then, you know, we were able to complete their treatment and then just, you know, try to keep routine care going. So, and in between that, you know, I traveled, and the other therapists do too. We traveled to other villages also, trying to do the same thing. So, yeah, there's a huge need. Mm-hmm.
Other questions from the audience? Yes.
Do you have any idea how many dental therapists there are now in Alaska? And secondly, how many therapists can a dentist oversee or supervise?
Stephanie.
Research. Go ahead.
They were asking how many dental therapists are practicing in Alaska, and how many therapists does a dentist typically supervise?
There's, Dr. Willard's coming over to answer some of these questions. I know there's 25 certified therapists that are practicing now in the state, and Dr. Willard might can answer that second question better.
Yeah, hi everybody. If you don't know me, I'm Mary Willard. I'm the director of the DHAT educational program here in Alaska, and we have. Yes, typically in our system we have anywhere from 1 to 4 dental therapists per dentist supervisor. And internationally, that number can be very different depending on how they've set up the system. In Canada, they would have 1 dentist whose only job was to supervise, and they would supervise anywhere from 8 to 20 dental therapists at a time. In New Zealand, I know the public health dentists often work with as many as 60 dental therapists at a time. So it depends on the system. Our system, our dentists are working full-time as dentists. So 1 to 4 therapists at a time is plenty. If you have a new dental therapist just out of school, It takes a little bit more time, and so one dentist may only want to work with 1 or 2 therapists at that time if they're also seeing patients. Okay.
Any other questions? Yes. Eric has a question.
Okay.
Can you talk a little bit about the process when you have to make a referral, and perhaps what is your most frequent sort of referral when you have to pass the case to a dentist?
Well, yeah, I do a lot of referrals, unfortunately, to a pediatric dentist for general anesthesia, for full mouth restorative under general anesthesia. So those aren't too hard to pick out. I mean, we just have children that have full mouth restorative that needs to be done. So that's not too hard to do. I mean, it's hard in the fact that our patients have to fly 500 miles and come down to the city, and logistically that takes some planning. And there's a 2 to 3 month waiting list that they're on, unfortunately. Things that I just refer to our dentist in Kotzebue are usually, well, obviously things out of my scope, which are any prosthetics and root canals or difficult surgical extractions. So we determine that, when we're on the phone looking at the radiographs, and if it's an extraction that looks like it's going to be difficult, then we'll just send them into the dentist. Is that good?
Thank you.
We probably have time for one more question. Yes, Karen.
Do you have any special training to work with people with disabilities? For instance, children with autism or individuals with mental health issues?
So, Stephanie, if you have any special training or experience working with populations with disabilities or children with autism or any dental patients with special needs?
Well, we did have some training in New Zealand, and I'm not sure what their training is here, but they do also here. You want to talk about that?
Yeah, in our program now here, the training program in Alaska, we use Dr. Paul Glassman's online curriculum for special needs patients.
And I do definitely work with our special needs patients. I feel like we see several of them, we see many of them, and so it's no problem for them to be on my schedule at all. I feel very comfortable treating children with any type of disability.
Well, thank you for taking the time out of your day to talk to us. Thank you for the care that you're providing in Alaska. We all are congratulating you on your 10th anniversary of Alaska